Welcome back to Mornings on 2. In today's Health Watch, the United States Surgeon General has called on Congress to require warning labels on social media platforms and their impact on young people. Joining us now to dig deeper on this topic is Dr. Mike with our Fox Medical team. Good morning, Dr. Mike. Certainly a hot topic for quite some time. As a medical doctor, what are your thoughts about a warning label for social media?
Oh, I think it's sorely needed, Pam. I mean, look, it's one big experiment, and look, we just don't know whether this is safe or not. And what the Surgeon General has said is that, look, kids on average are using social media about 5 hours per day, and there is a risk of harm to the mental health of our young people. Numbers of kids that have low self-esteem, body image issues, as well as depression, anxiety have gone up. And so there's a lot of concern about this. And I think just like any other product, there needs to be a warning label on there saying, hey, this product may or may not be good for your children.
As you mentioned, mental health, certainly physical health as well, as more people are just sitting online. Is this now something that is discussed as a regular checkup? Do you discuss this with patients at this point?
Well, I think that when it comes to everyone is on the phone, and when it comes to kids, I have had discussions with my children, my wife and I, about the fact that, look, you can't just sit in your room and be on a screen all day long. You need to get out. You need to get outside, exercise, and be with the family. This can be very addictive, and the way they work it is using AI, and they are able to really analyze what intrigues these young people and gets them to use it. That's the whole idea. So the bottom line, in my humble opinion, is that you need to find some way to work with your kids to say, look, it's not cool to be on social media all that time every day. And it's not easy, Pam. It's not easy being a parent. How do you do that? How do you filter out what's good and what's bad? It really needs to come from legislation, and we need to get these companies to say, look, we're not going to do any kind of tracking. We're going to do the right thing, and we're going to keep our kids away from harmful material.
Certainly, I can relate. It's been difficult being a parent raising these kids for the first, social media generation, basically. Should this also be part of when we assess a patient's overall health? Should this be part of that discussion?
Oh, absolutely. And I think my pediatrician for my kids certainly brings this up, just like asking, how is everything going in your life? And the key here, Pam, just like with diet and exercise, getting kids early on to develop habits that are healthy, to prolong their lives, and throughout their lives, they will have a better trajectory if we teach them early. And by the way, setting an example. A lot of my patients, I'm an adult doctor, I see adults 18 and up. They're addicted as well. And you really have to be careful with that because we're losing our ability to communicate, Pam. Instead of talking to people, everybody's on their phones, and it's not a good thing. That is in my opinion.
Really good point. We need to serve as examples and not be on our phones all the time ourselves. Thank you, Dr. Mike, for that.